morning. My name is Mindy. I am the 2020 Athena Young Leadership Award recipient. I'm here with Jessica Scharfenberg. She is the 2022 Young Athena nominee. So welcome.
Thank you.
So why don't you tell everyone a little bit about yourself and what your role is?
Yeah, absolutely. So my name is Jessie Scharfenberg. I'm originally from southern Wisconsin. I went to school at Edgewood College and got my nursing degree. Moved up to South Dakota because nurses can go anywhere that they want to go, and worked at a critical access hospital out there for a few years. I always said I was going to work in the ER or in labor and delivery. I wanted that on-the-go constant, but when I got out there and I was working, what I noticed a lot was the health inequities that individuals were facing. So that's when I decided to change gears and go into public health. If you ask any of my colleagues from nursing school, I hated public health. I was never going to go into public health the rest of my career as well. So worked out there for a while in public health as a regional manager for the South Dakota Department of Health. And then had our second baby, and Grammy and Papa's that are 8 hours away is really difficult. So we started looking to move back to Wisconsin. And it was at that time Family Planning Health Services was hiring for a CEO. So interviewed and received that position. I've been here for 6.5 years now. And in 2017, we rebranded to HealthFirst to be more inclusive to the services that we offer and what we do for the individuals that come through our doors. We have 9 locations for our reproductive health clinic. We added our most recent one in Marshfield just last year. And then we do WIC, which is the Women, Infant, and Children program in 4 of our counties, which are our northern ones. It was 3 until April. We added another location in Taylor County. So have continued to grow our footprint, focusing on reproductive health, sexual health, and then maternal child health, as well as the nutrition side of things to make sure our families can eat.
Awesome. All good things.
Yeah, it's really exciting. You know, I was never into public health. I was never into this realm, but once you start noticing how much prevention can actually make an impact on birth outcomes, specifically looking at Wisconsin, we have one of the highest maternal mortality and morbidity rates in the United States. Trying to make those impacts ahead of time so that we prevent some of that is really one of our goals here at this organization.
Yeah, that affects a lot of people.
It does.
Yeah, and I'm sure you made some really good connections with every person that comes through.
You know, we do. One of the things that we've really prided ourselves on, and it's a change of way for reproductive health. A lot of reproductive health clinics, let's get them in and get them out for their STI testing or birth control method, that type of a thing. 95% of the clients that walk through our door don't have a medical home. They don't have a primary care provider. So we've really grown our services to be more inclusive. So let's get that annual exam done. Let's get some baseline labs done. Let's figure out what's going on with that individual as a whole person, because we know reproductive health impacts the individual as a whole, not just their reproductive health organs.
Mm-hmm. Well, I appreciate everything that you're doing for everyone that needs the services.
Thank you.
So, well, I'll go ahead and I'll just start with some of the questions and we'll just keep on going.
Okay.
So can you share an example of a time you have advocated fiercely for yourself, another person, or a cause?
I think right now, since June 24th, there's been some fierce advocation through our organization. That's when the Supreme Court issued a decision on Dobbs versus a women's health clinic regarding abortion services. HealthFirst does not provide abortions, we never have, but we believe in choice. We believe that individuals should be able to choose when, if, and how they want to grow their families, and that decision was taken away from individuals on June 24th. So we are working here locally, but we're also doing some huge advocacy at the state and federal level of how do we ensure individuals continue to have access to the services that they need and they deserve. One of the things that we're really trying to do is help individuals understand that this is an intimate decision between a healthcare provider and an individual. This isn't a political decision. Mm-hmm. It goes much more beyond just abortion services. We've had so many issues and troubles with miscarriage management and ectopic pregnancy management and trying to advocate for those individuals for the care that they need. So one of the things when an individual is miscarrying or having a spontaneous abortion, the medications that are used to evacuate the remains of the fetus or the tissue that remains, they're the same medications that are used for an induced abortion. So women that are miscarrying have been asked to prove to their pharmacist that they're trying to get these medications that they're actually having a miscarriage. And as a woman going through a miscarriage, having to prove and bring in paperwork to say, yes, I'm going through one of the worst times, and trying to communicate as much as possible for individuals to understand how the 1849 law actually affects care in Wisconsin. But providers and systems are providers. Their biggest concern right now is their licensure and their livelihood, because there's so many threats against both of those. If they help an individual in so many different ways, that a DA is going to come and press charges against them. And we know most likely once it goes to the court system, there's no legal standing for it. However, it takes the time, it takes the money, and potentially their license and their job to get through that. And it's just one of those things that we're trying to help people understand what the decision actually has done to individuals in Wisconsin. Not just the ones that are seeking abortion for whatever reason that may be, but those that are experiencing miscarriage and ectopic pregnancy is a huge issue right now, especially in our area, that they can get the care that they need without having to get to the point of choosing, okay, is this now considered life-threatening to the mother? Because that's how the law is currently written. So we're doing a lot of advocacy around that. But the other thing that we've been working on since February, which is huge, is the formula shortage. So WIC entities provide about 75% of infant formula in the United States. So if you look at Marathon County and the surrounding areas, we're providing 75% of the formula, and it's not necessarily us physically handing out the formula. We provide them an EBT card so that they can go to the grocery store or Walmart or wherever they want to go to get formula, and there's no formula on the shelves. So that's been a huge thing. So one of the things that we did right away is we created a partnership with an entity in Milwaukee, and we went down and got 1,000 cans of the big formula, and we were able to hand out free formula to our participants during that time when there was nothing on the shelf. Then we worked with United Way and the Community Foundation, and we brought in about 1,500 more cans of formula. So we kind of were able to bridge that gap for a while to help individuals be able to receive formula. But now we're working on the larger advocacy side of things, of formula starting to come back on the shelves, which is great. But how do we prevent this from happening again? So one of the things that we look at is back in 1989, 33 years ago, the federal government said that states have to contract with a single formula provider. That's created a monopoly. So all of these smaller formula providers and manufacturers don't manufacture much because they know WIC is going to be almost the sole buyer of those items. So we're looking at how do we advocate that we change some of these federal regulations so that states can contract with multiple formula providers. So when, and more likely if this happens again, we don't get into this situation of trying to figure out how to feed babies, because that was a huge crisis for our families. They don't have the money to just go and buy formula to begin with, and now what they were provided to buy formula with, they couldn't because it just wasn't there.
Right? Yeah, so it's very scary for the unknown for multiple parties. And you guys, your organization has been really a foothold, I think, that people can come in and trust and know that, there's someone there to help.
Yeah, we've been working hard on that. It's been a really trying year for everything that we do. I think one of our major concerns that we're trying to provide advocacy around right now is contraception access, because we know the Dobbs decision overturning Roe versus Wade was just the tip of an iceberg, and there's already been attempted attacks on birth control methods, and right now we need to ensure that individuals can choose when, if, and how they want to grow those families. So ensuring access is huge right now.
Good. Let's see. Can you share an example of a time you brought another woman into a leadership position on a project or cause, and what did you learn from that experience? So
75% of the leadership at HealthFirst is women. It's all individuals that I've hired. In public health, we don't have a huge candidacy pool that is men. So it's really looking at the females that are in the industry and who's going to help move things along. The latest hire was Leanne Asham. She's our reproductive health service line manager. She is amazing. She's really moved things forward for our reproductive health clinics. I think women in leadership is empowering. We hear a lot about that glass ceiling. And, women are going to hit that glass ceiling, but if you take down the glass ceiling, then there isn't one to hit. So how do we continue to grow the individuals within our organization and the women in our communities, giving them options? I've been mentoring several different students across the state, whether it's Medical College of Wisconsin, they're working on a few different projects and giving them projects for their physicians in the community side of their schooling that they have to do, and just mentoring them through that and giving them projects and activities to do and things to study related to our organization in the community in general. We're working with UW Public Health Department out of Madison. We have a student that's actually working with our social worker. That was one of the biggest projects that I've recently given to another woman leader, and we actually hired a female social worker. We're really excited about that, as we saw that as a gap in our services. Our providers are very busy, which is great, but we serve a lot of very complex individuals, and they don't have time to make the 10 referrals that an individual needs: clothing, getting hooked up with education or Medicaid, whatever that may be. They didn't have the capacity, so bringing a social worker on staff really has helped us to transition that from the provider's responsibility, but having an individual really integrated into the community and knowing all the resources to help bring individuals forward to be able to reach their goals.
Oh, that's good. Yeah, it's nice to see how everything kind of spider webs to be able to find those gaps and be able to create a wholesome organization that the community really needs.
Yeah, and it's mentorships I love, because hopefully they're going to practice, especially with the Medical College of Wisconsin, hopefully they're going to practice in this community when they're done, and then they're going to know the resources that are out there for the clients that they're going to serve, and it really just builds that spider web of things that individuals are going to need for resources and knowing where to send them, versus someone who's just moving to the community. They're not going to know those resources, but if we can build from within, it's extremely important.
Can you share an example of how you serve others in our community?
So not necessarily just here in Wausau, but on a larger aspect. I'm the president of the Wisconsin Family Planning Reproductive Health Association. I'm really involved in the Reproductive Health Task Force at the state level and the National Family Planning Reproductive Health Association. I coach Little League. It's fun. The little guys, I always say it's similar to herding cats, because to run at the same ball at the same time. So just being involved that way is important. Serving as the mentorships, being part of Impact 100 was one of the other things. So just anything that I can do to not only spread the word of what we do, but help bring other individuals forward and make them successful in their lives and their jobs. Just giving people a chance, I think, is a huge thing that we sometimes lack. Maybe a lot of people need chances, so being able to give them those chances and being part of groups that help those individuals is really important to me.
Yeah. Well, you're a force to be reckoned with.
It's really funny. Brian, you actually probably have it over there. I was a keynote speaker yesterday, or 2 days ago at the Wisconsin STI Summit, and they have all of these fun little tags of what you could pick to have on here. So I actually, something very near and dear to me is the J1 visa population. They're the workers that come to like the Dells area.
Sure.
And we've been working really closely with them because of the health inequities that they face and the lack of health care coverage that they have when they're here. They basically don't have anything. But when the time is here and they're here, things happen and they need help. So we've been really helping with them. So I gave a presentation on that. And two of my colleagues from other areas in the state, they're like, oh, I think these ones really describe you. So one of them was everybody's nightmare. And that was one of my colleagues from Eau Claire County. She's like, you really need that, because when something needs to get done, we just ask you and it ends up getting done. Like, nobody asks questions, it just gets done. But that's just because I'm really passionate about what we do and how we move forward. And the other one was, I should have used a glue stick, not chapstick. Because, sometimes people like to bite their tongues, but I'm not one of those. If something needs to be said, we need to say it and have that conversation. The abortion conversation is one of those things people don't like to talk about. It makes people feel uncomfortable, and I understand that. However, it's a conversation of we need to understand what the actual impact of those laws are, not just on induced abortions, but all of these other things that is trickling down to, and when we're thinking maternal mortality, individuals, just really having some of those frank conversations have to happen so that there's a broader understanding of what the impact is.
Can you share an example of how you've acted courageously?
I think
I know it's probably a daily
should have
thing.
used a glue stick, not chapstick. You know, it's really difficult. We have protesters all of the time. We don't provide abortions. We provide contraception. By having those conversations with them, the previous life of family planning health services, they didn't have those conversations. But it takes a lot of courage to go out there and what don't you agree with, and then explaining, well, this is what we actually do and how we do it, and having those conversations. Whether they're going to leave or not is something completely different because they're not going to leave. But having those conversations is just so important. And it takes courage to go and have those conversations. It takes courage to go and stand in front of a group of 200 people and talk about what's happening to the J1 individuals that are coming over here, when I know the corporations in Wisconsin Dells are probably, shut your mouth, please. We don't want anyone to know this because this is our bread and butter. This is how we keep our businesses growing, which is good. But if you don't have a healthy workforce, you don't have a workforce either. So having those really critical conversations, it takes courage, but it's one of those things that I don't back down to. I think if you ask any of my team members, whether it's one of our clinic assistants or someone on the leadership team, I'm pretty feisty, and I don't back down too much because we're really working on how do we impact individuals and how do we make the most for everyone.
Yeah, and I think the base foundation of how I'm understanding you, because I've never met you before, and I'm very happy to know you, is that it's all about education.
Education.
Yeah.
Education. It's really interesting. Last Thursday, we're working on figuring out what marketing firm we're going to use next year. We went out for RFP. We have all of these people, and we're talking, and we're standing out in the hall, and Jerry's like, you know, we need to write a blog. You have a lot to say, and nobody gets to hear it. And I'm like, you know, that's a really interesting concept. Little did he know that I love writing. So we are actually going to be launching the blog next week, and I have our first 3 posts, but the one I actually wrote this morning was around education. Mm-hmm. We need to educate on what is actually happening, what is the impact of all of the decisions, what's happening. So one of the big things is around STI. So we're at an STI summit for the last 2 days. STIs are through the roof, but it's because we haven't educated, and we don't want to have the conversation that humans are sexual beings. It is what it is. We don't have the conversations. We don't normalize that conversation. Mm-hmm. It makes huge stigma for individuals to actually come and get tested. So they continue to partake in their sexual activity without getting tested, and now we are in an epidemic with STI rates through the roof. We're seeing the highest congenital syphilis cases we ever have in the state of Wisconsin after about 10 years ago when there was like nothing. It was great, but we don't normalize the conversations. We don't have the education. Part of the blog, if you guys ever want to read it, is going to be about educating our youth, because statistics show that kids start talking about sex at 9 years of age. Mm-hmm. On the playground. When I was 9 on the playground, I was not an expert in sex.
Yeah, and there's so many things that are more accessible.
Right, when you start looking at the internet, there's none of the blocks of what they're looking and what they're Googling. So the conversations that they're having are highly, highly inaccurate. They're not the truth. But no one is providing the actual education of what's going on. I mean, it's hard enough to get them to use correct anatomy names, which is really important for individuals to know the correct anatomy. But we don't do that education. So we do a lot of education, whether it's in schools for reproductive health, whether it's going out into the community to talk about WIC and nutrition and all of that. One of the things I love about the WIC program compared to SNAP benefits, which is the same as food stamps, is if you are on WIC, you have to go for nutrition education to have the benefit, but it also only provides healthy foods. So you have to meet it. All of the foods that we provide meet USDA standards for a healthy diet, versus if you're on the SNAP program, you can go get soda or chips or pizza, which are convenience foods for individuals who don't know about healthy foods and the benefits of healthy foods and stuff like that. So I'm not going to discredit that. But if we can insert education into it, we just become a healthier community that way.
Mm-hmm. Oh, absolutely. And I guess the last question on the list, can you share an example of a time you brought another woman into leadership position on a project or a cause? I think we actually read that one already, huh?
We did.
Yeah.
Well,
we did.
That was the last question then. But it was really just a great opportunity for me to meet you today. It wasn't for doing the interview, I don't know if I would have met you in any time in the near future, but I really appreciate everything you're doing for the community and the support, and of course the education, and also being an advocate for a lot of different people in different avenues of life. So
thanks for coming in. I appreciate it.